So when the patient has long-standing acid reflux, sometimes the esophagus itself makes a change, an adaptation to the presence of acid in the esophagus. One of those changes is called Barrett's esophagus. And in that condition, the esophagus actually changes a portion of its lining to a different type of tissue that is actually less acid sensitive. The analogy I usually give patients is if you had an area in your house that's a high traffic area, maybe by a sliding glass door by the back of the house, and you have carpet there, and you walk over that day in and day out. Over time, that area starts to get worn out, and you might look at it and say, maybe we should put down a laminate or a wood floor or tile or something that's going to wear better. Well, the esophagus actually does the same thing. So when there's long-standing acid damage, sometimes a portion of that lining will change to something we call Barrett's esophagus tissue. And this Barrett's tissue can fool us in a few ways. Number one is it's less acid sensitive. So sometimes patients will say that they don't feel their acid reflux as much anymore. When I hear that history, sometimes I worry about Barrett's esophagus. The problem with Barrett's esophagus is that adaptation is not in the patient's best interest because that tissue has precancerous potential. It can evolve down a precancerous pathway to the development of esophageal cancer. The most common type of esophageal cancer in the United States is esophageal adenocarcinoma, and it is generally accepted that all esophageal adenocarcinomas in general come from Barrett's esophagus tissue.